Green Mom Guide presents Health Notes with Dr. Sydney Spiesel.
I'm Sid Spiesel. I'm a pediatrician with a kind of weird background because I wasn't always a pediatrician. I was once a public health microbiologist. I am a cellular immunologist also, although I don't use my immunology as much as I used to. That's pretty much me. I'm also particularly interested in behavioral issues and developmental issues in children. I went to college at a tiny little school. My graduating class actually had 14 people in it. There was a school called Shimer College. After I finished college, I spent 3 years working at the Illinois Department of Public Health as a public health microbiologist. And then I came to Yale for graduate school, and I got my PhD in cellular immunology here. And then I actually did some teaching and some research, but after that I really went to medical school here, also at Yale. And I don't know, Yale got to be a habit, so I did my internship residency, and I did some other stuff here. I'm a pediatrician. I'm actually a clinical professor of pediatrics, so I still teach. I have a formal commitment to teach 1 day a week, and I have a private practice in Woodbridge, Connecticut. Well, I was trying to remember that. I think it's about 40 years, something like that, give or take a couple of years. The internet is a wonderful thing and a terrible thing at the same time. I have all my life believed in the importance of free information, that everybody ought to know as much as they possibly can. But you also have to understand that one of the great things about the internet is that people can say anything they want, right or wrong. And a lot of the things that are said are incorrect. And there's also a kind of funny mental issue that we all have as human beings, which is that anything that's presented to us in Times New Roman has a greater sense of greater solidity and validity than that same message scrawled in chalk on the sidewalk. But it may not have any greater accuracy or correctness. And that's a problem. Right now, there are a lot of things sort of circulating around the internet, and it's hard to, we're all conspiracy theorists these days, and so there's always a sense that, the medical establishment, they're probably trying to put something over on us. Now, sometimes medical recommendations are not as smart as they should be, and are not well thought out as they should be, but most of the time they're pretty good. One of the benefits of having come from a career in science is that it made me really, really skeptical of things. So I tend to be looser around most questions.